Through his experience in setting up clinical trials, physician Edward Watson noted the huge discrepancy in medical care costs between his homeland of New Zealand and the United States.
From that position, I made the link that New Zealand would be an excellent place for people to come from America to have their medical procedures, because the quality would be exactly the same as it would be in the States, if not better, for a significantly reduced price.
With this in mind, Watson created Medtral New Zealand, a company focused on providing the highest quality medical travel experience possible to patients seeking non-acute procedures such as joint replacement or cardiac procedures in a first-world, English-speaking country, but with significant savings. In fact, packages cost between 30% and 40% of the procedure alone in the United States.
What we try and do is provide a fully integrated service whereby patients from overseas can come to New Zealand and access our high-quality, excellent healthcare in the private sector.
To guarantee everything runs as smoothly as possible, Medtral takes a holistic approach to medical travel, providing each patient with a personal coordinator who sees them through every step of the journey, from their flight on Air New Zealand to post-op physical therapy to their return flight home.
We will meet them at the airport. We will transfer them to a hotel of their choice that we have arranged previously. We'll also get them to meet the surgeon before the operation.
The surgeons used by Medtral New Zealand are among the most qualified in the world, speak English as their primary language, and are trained at renowned hospitals in both New Zealand and North America or the UK. Two examples of the many highly experienced and internationally trained surgeons that Medtral patients have access to are orthopedic surgeon Dr. Gary Hainan and general surgeon Professor Jonathan Koia. Hainan, who completed fellowships at Massachusetts General Hospital and the Institute for Bone and Joint Surgery in Phoenix, has had years of experience performing knee and hip surgery both in the U.S. and New Zealand.
Dr. Gary Hainan is a very experienced surgeon who has years of performing hip and knee replacements. He has an excellent reputation both in New Zealand and abroad, is often invited to speak at overseas conferences on his expertise, and involved by the American manufacturers of implants to be involved in the testing of their new prototypes.
In New Zealand, we have a mixture of conservatism and also looking at new technology, and I think we err towards a balanced attitude. We're not quick to jump on the bandwagon for new techniques until they are showing some degree of proof, and I think that's very important, and certainly as far as patient safety is concerned, I think that's a major concern.
Professor Koia spent many years at the Sloan Kettering Memorial Hospital in New York, perfecting his liver and general surgical skills before returning home to New Zealand.
Personally, being able to train in a great centre in the US, I was able to acquire some skills and then bring them back to New Zealand where there was clearly a need.
Hainan runs his practice out of Ascot Hospital, one of two highly accredited Auckland-based facilities used by Medtral New Zealand. Koia is based at Mercy Hospital.
I decided early on to work with Mercy and Ascot hospitals because of the fact that Mercy and Ascot are world quality in terms of the provision of the healthcare that they provide. Their facilities are state-of-the-art. They're as good as anywhere in the world. Their staff are very motivated and very passionate about what they do, as are the management of both hospitals. They're very keen to see that international travel to New Zealand is the forefront of what they provide. They have a lot of experience in being non-acute surgical hospitals, and they do a lot of procedures per year, between 15 and 20,000 between them, so highly experienced.
The hospital I work in here at the Ascot provides probably some of the best facilities I've ever worked in. You have your own room, you have dedicated staff, you have a physiotherapy department which is very active in your rehab. And the other important thing, which is slightly different from the States, is that we don't have a huge emphasis on discharge.
When it is time to leave the hospital, patients will be escorted to either an upscale apartment or one of two elegant hotels for recovery.
We've tried to provide a range, so we have very upmarket luxurious hotels like the Western Hotel, which is a brand new 5-star hotel here in Auckland. This is again a world-class hotel, but at a very, very reasonable rate.
With a population of around 1.2 million, Auckland is the largest city in New Zealand. Known as the City of Sales, Auckland has the ideal climate for recovery, reasonable rates throughout the city, and an exchange rate that is very attractive to American travelers. These same savings are reflected in the cost of health care.
We can actually perform a hip replacement probably in cheaper dollars than the US dollars, and then take into account the exchange rate. It does make a difference.
And for Watson and the other doctors at Medtral, making a difference is a way of life.